You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Peter Wöhrle. Dr. Wöhrle, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, tell us a little bit about your practice in Newport Beach. Do you mostly focus on dental implants?
We provide the entire range of services, but basically the main focus and all that I'm doing is dental implants.
Okay, what kind of patients are there? Mostly older patients, younger patients?
Well, we see, of course, the entire gamut from young people that either lost their teeth because of an accident to the middle age that kind of lose 3, 4, 5 teeth, all the way up to patients that, of course, had dentures and have no longer any teeth.
Okay, now your background in training, I guess you have 2 specialty trainings, prosthodontics and oral surgery. Tell me about that.
I did my dental training at Harvard University, and at that time...
so Harvard has a dental school?
Certainly does. The oldest dental school in the country, by the way.
Okay.
And that time I was in the right place at the right time. They opened up the first department of implant dentistry at Harvard, and I was their first student. So I did the first postdoctoral specialty program at Harvard in implant dentistry, in addition to my specialty program in prosthodontics.
Yeah, what is prosthodontics?
Prosthodontics is a specialty that deals with the maintenance and the replacements of teeth.
So now at your center, I guess you're a little bit different in that you do the surgery, you also put the tooth cap on, and normally that's done by 2 different dentists.
Yeah, typically that's done by a multiplicity of different providers, where maybe general dentist diagnosis and then oral surgeon or a periodontist inserts an implant, and then either the general dentist or the prosthodontist restores the implant. Since I'm trained in all the areas, I have somewhat an unfair advantage in that we still do the team approach, but it's just a team of 1.
Is that better for the patient, though?
Of course. How many people would you like to have working on your house? If it's just 1 person, you know, if there's a problem, or even with issues with the price, so if there's only 1 person, you get a much better outcome most often of the time.
Okay, what's changed, by the way, over the last 20 years? We've talked, you say it's much better.
Oh,
implants
in implants,
Why?
yeah. The procedures are much easier on the patients now. A lot of procedures were developed to load implants earlier, faster, have less invasive surgery, better diagnostic tools. The first surgeries I've done 20 years ago.
20 years ago?
Were massive, and the patients had massive swelling, and today we can...
Was it a lot of cutting back then? Now it's less cutting?
Yeah, we had to open up big flaps, we had to gain access just to take impressions of bone, whereas today, with computer-generated surgical templates and CAD/CAM, we can do very small incisions, deliver the implants, and the bridge is much faster, much more predictable, and much better looking.
Now, in your center, you even have a CT scan.
Yes, we have a
right?
CT scanner, cone beam, low radiation CT scanner. We use it every day just because we need to have a 3-dimensional volume of the bone.
Another thing, you say you can do the surgery before you do the surgery. Elaborate on that. What does that mean?
Yeah, we basically, when the patient comes in, we make some diagnostic scan so that we have a virtual reality model, a 3-dimensional model of the jaw structure of the patient, and we actually place on the computer the implants so that by the time the patient comes back for surgery, the location of the implant is predetermined.
Okay, and some people get their teeth in 1 day.
Right. That, of course, then if you predetermine the location of the implant, that allows you to make the teeth ahead of time, and if the implants are then inserted at exactly that location, we already have the prefabricated teeth, and that can get delivered at the conclusion of the surgery.
Okay.
And this, of course, can be done now much faster than the surgery we did even 5 years ago.
So the downtime has been reduced?
For the patient?
Yes.
Oh, of course. It's with these full arch procedures that are standard, there's basically no downtime.
What about pain? It seems very painful to get a dental implant.
That's the number 1 fear of patients is of course pain. I'm happy to tell you that there's no pain fibers in the bone, so whatever we do and you could feel is it related to soft tissue, and since we make such small incisions within the soft tissue, there's very minimal pain.
Okay, what about bone grafts, things like that? Is that a thing of the past, from the hip?
In general, we still do it in accident victims or special cases, but for the vast majority of patients, bone grafts are per se, because with today's technology where we can actually find the bone on computer scans and use it, then we can restore patients without graft.
You say denture wearers benefit the most.
Of course, I mean, who would like to wear dentures?
No, I guess not.
Nobody likes to wear dentures. The gums weren't designed to have dentures on top of them. Nobody likes to put that glue in the dentures to stick them in so that they're not embarrassed that they fall out. And fortunately, today we have the technology to eliminate those dentures very predictably, very fast, and much more cost efficient.
So they can get something fixed in their mouth?
Yes, yes, and that's all we do. We actually haven't done an overdenture where a denture secured 2 implants in the past 5 years.
It's like snap in, snap
That's right.
out.
Past 5 years. Everything we do is fixed reconstructions.
Okay, but you will do those snap in, snap out.
I haven't found a patient that
wants to do it.
That wants to do it. It's typically because of inadequate bone volume, but today's technology, we can overcome that. Even in the long-term cost issue, it's comparable to what's called an all-on-4, where we have a fixed bridge, but much less maintenance.
So all-on-4, you mentioned. That's what's hot. That's what's new in the world of dental implants. What does that mean?
Where an all-on-4 basically means that we place 4 implants per jaw.
For a denture wearer.
Or people that are about to lose all their teeth. For somebody that has no teeth, whether they just lost them or whether they had them for 20 or 30 years, the dentures. And then we just go ahead and then place 4 implants in strategic locations, and those 4 implants are distributed in such a way that it can support a fixed bridge. That is
something that just
permanently attaches to the implant.
How does it feel? I mean, does it feel like they get their teeth back?
Yeah, it's the next best thing to teeth. It certainly doesn't feel exactly like your teeth because of the proprioception, but it's very, very close. And of course, if you have worn dentures for many years, it's a heavenly gift.
Now, on the right candidate, how soon can somebody eat? Okay, so denture wearer, they go in, they get this all-on-4 procedure. How soon can they eat?
Immediately after the bridge is attached to it.
That day?
The very day. The implants are very stable. They're connected together with a bridge. And with today's surface technology on the implants and good placement techniques, the implants are
But it
stable.
always wasn't that way, is that right? I mean, we've been doing the show now for 10 years.
That's right. I mean,
and I used to hear 6 months and 8 months.
That's right. That had to do with implant surfaces that were not as advanced as today's implant surfaces. So the bone turnover along the implant surface.
So the bone, what, grabs onto the implant better now?
Much faster, at a much higher rate. Plus, we have better techniques of placing the implants more stable.
Okay.
And that then allows, in most cases, what we call immediate loading. Now, there are some cases where we cannot do it if we have no bone or grafted bone.
Yeah.
In those cases, we still have a healing phase, or if you have soft tissue problems. But the vast majority of cases, especially denture wearers, we can do what's called immediate loading.
What about age ranges? You know, anticipating this interview, I knew I was going to interview today. Talked to my mother. She's 73, good health. She says, and she's wearing dentures since she was 28. She said her medical doctor said she's too old. They'll fall out.
Too old?
Yeah, 73. And that's opposite of what you told me.
That's right. With 73, I mean, if a woman today with 73 probably has another life expectancy of 20 years. And between you and me, that's a long way to go in dentures.
So but why would a medical doctor say that they'll fall out if that's not true? They just don't know?
No.
So that's just not true?
It's not true. Implants are placed in the bone. The bone in the skull is the last bone if the body needs calcium, whatever gets resorbed. It's the last place in the body where it gets resorbed. So the skull is the perfect place to do the implants.
What about sedation, things like that? Because I guess people are still afraid of going to the dentist.
It will depend on the patient. An all-on-4 and an all-on-6 is a routine procedure. It takes us less than an hour. There's very small incisions.
I mean, for everything less than an hour, I mean, somebody goes in, they have no teeth.
No teeth.
Denture wear.
That's right.
They walk out, they have something fixed in their mouth.
Less than an hour.
Okay.
Yeah. So in these standard procedures, we just give local anesthesia if the patient doesn't have any underlying medical issues.
Okay.
If there are problems with the heart or blood pressure or any other medical problems, then we have the anesthesiologist.
What about osteoporosis? Can somebody still qualify for dental implants if they have some?
Of course, osteoporosis is primarily a disease of long bones, meaning the legs, hips, hollow bones,
so
big
not
bones.
The jaw.
The jaw typically actually gets denser the older you get. So if you resorb bone, as you lose bone, the remaining bone is much better quality than a bigger bone.
Okay. What are the misconceptions out there, by the way, about dental implants that you hear on consults by denture wearers?
Well, I mean,
I guess pain, they think it's really painful.
Pain is one thing. Then they cannot quite imagine on how, after the face has fallen, and how we're able to restore that. And of course, we not only replace...
What do you mean the face has fallen?
Well, as you get older and you lost your teeth, the bone continues to resorb. And of course, you know, the typical denture wear, where the lower face height decreases, the chin is closer to the nose, and the lips fall in because there's no more support by the underlying structures. And of course, we not only replace the teeth, we also replace the alveolar process, the bone, in these areas on the prosthesis.